Ma'am, could you give us some important data in the aspect as to how the PM CARES Fund has been completely utilized? Because there are lots of Indians themselves who feel that there has been an underutilization of the PM CARES Fund, and there is a sense of dubiousness as to in which direction the funds have been used because they feel that there's a lack of transparency. So, could you just, if you could give us some very important raw data as to which commodities and resources have been procured, that would be really appreciated.
Yeah, so I mean, on PM cares again, what has been done with it, how it's been used, or what it was intended for. I think a lot of it has been put out in the public domain, and I think that's what I have access to as well. But I'll just try to summarize, briefly what that is. And I think it was majorly when it was brought in. It was basic healthcare infrastructure like ventilators, which of course over the course of the last year we built up much more capacity. When we started the pandemic, we were struggling with even ventilators and 95 masks, the PPE kits, even the basics. But after that, we have actually ramped up our capacity significantly for all of these. And so I think we are to that extent in a better position. But of course, in a surge like this, you still need much more additional capacity. And that is why a lot of countries are rightfully now stepping in to provide that capacity, because we've also helped a lot of countries over the last few months. So it's important that they are coming forward, and they should come forward in a bigger way. So I think ventilators is one big piece of the utilization and what it was intended for. The other is for the welfare of the migrant workers. A certain component has also been used for that, because again, lockdowns, etc., we know that it affects the migrant workers, the poor, in the worst possible way. So there's a lot of welfare measures that have been brought for the migrant workers, whether it's and this is not just PM cares, but I'm just still putting it out that the One Nation, One Ration Card scheme, for instance, to provide food to migrant workers and their families across the country. So various such initiatives, but a certain component of the PM cares fund also went directly for the migrant worker welfare and for the welfare of poor people. Now, also, the PM CARES Fund is going to be used. The funds have been in principally sanctioned for setting up medical oxygen generation plants in public facilities, public health facilities across various districts in the country. And as I said, this is with an eye towards the third wave as well. Because it's not the immediate situation, of course, we are importing, we are doing, whatever we can, we are diverting from non-essential oxygen uses, etc. We are diverting everything towards medical oxygen supply. But with an eye to the possible third wave, these plants have also been sanctioned, given in principle approval. So we should also see these medical oxygen generation plants coming up now, across most of the districts in the country. So that is also something that the PM Cares Fund is to be used for. So I think those are some of the key, the broad highlights. Of course, I think it might have been used for some other initiatives as well, welfare initiatives or healthcare related initiatives. But these are some of the major pieces, and also the research and development. The vaccine research and development. There is also a component of that which has gone towards vaccine research and development. So I think that is, and a lot of this information, of course, has been put out, by the government in terms of what it's being used for, and continuously also the government is putting out how much allocation is being made for what from this fund. So that is really the information we have on this. But as I said, it's not just the PM Cares Fund. We're using various other channels of resources funding at this point to make sure that we can boost capacity, not just for this wave, but also prepare now much better for the third wave.
Certainly. And ma'am, as you mentioned that there has been a lot of allocation of the funding from the PM CARES Fund towards the procurement and the installation of oxygen plants. So a piece of very important news that was circulated very recently said that the tender for inviting bids for the setting up of 150 oxygen plants was floated in the month of October 2020. Could you tell us why this decision wasn't taken earlier, as in before October 2020, when the pandemic had hit the country right then in March itself, February, March itself? And also, why was this not executed to the complete optimum level? Because as we can clearly see, there is a current oxygen shortage in the nation.
Yeah, so again, I mean, one part here is again the sheer demand supply situation, because the sheer demand for oxygen right now, even if we actually probably had all these plants up and running, we might still have been short, because the demand today is extremely high. When you have 4 lakh plus confirmed cases a day, any health system is going to find it very, very difficult to not run short, and therefore the need to import, the need to get help from other places. So I think that is one side. But that aside, I think the plants, initially the ones which were sanctioned, the procurement, the tendering process was central. So it is not that the states were given those. The procurement, the tendering for that was done by the central agencies. What the states had to do was to identify the hospitals where those could be installed, and to do the ground level work. Now there is definitely different versions. A lot of the states are of the view that that work did not happen speedily enough, in terms of the contracts that were given out. But a lot of the contractors, on the other hand, say that some of the hospitals, there was actually a delay at the hospital end, in terms of actually giving us an appropriate site, or helping us set up these plants and get through all the administrative procedures. So the jury is of course still out on that. That is something which will need much more investigation, in terms of where exactly the lapses have happened as far as that is concerned. But that is the central, we're talking about the plants which the center was to tender and procure. Simultaneously, nothing has stopped the states from procuring their own plants or from setting up their own plants. So that is important to understand. There is one central channel and there is a state channel. So even if the central channel was not working, nothing was stopping states from actually also setting up these plants to boost their own supply. So I think somewhere, there have been a lack of, I would say, anticipation at the level at which this could go. I think that is where, if there is something that we can be critical of, it could be that in hindsight, you can say that there was a lack of anticipation, or there wasn't enough anticipation that we could land up in this situation. But again, that is sort of tough to say, that how much do you really anticipate, because today we are at 4 lakh cases. I mean, this could be so much more, or this could be a very different picture. So anticipation in a short period of time is a matter of hindsight, is up for debate, whether the fault lies with the central, suppliers, or people who were to install the plants, whether the delay was at the end of hospitals. But it is important to say that the state channels were also open. So it wasn't just the center which would be procuring and setting up. Now the plants I'm talking about are going to be sponsored, through the PM Cares Fund. So these will have much more of a central element and angle over there. But historically, the ones we are talking about, a lot of the delays seem to have happened in the administrative, issues, the tendering, the actual setting up, and so sort of between the suppliers, the manufacturers, the actual hospitals, the state governments. So we need to see where exactly those lapses have happened. But that is a matter of looking back in hindsight. But I think it's also a case that even if states were struggling with the central process, they could have still set up their own plants, and nothing was stopping them from that. So I think that is also important to understand. And I think perhaps, unfortunately, a lot of states also, there were some lapses, or they did not anticipate as much. As I say, rather than calling it a lapse, I would rather put it as, not being able to anticipate it to this level. And I think that is something that we can say that might have happened. But now going forward, now that we will have plants in pretty much all the district headquarters, the main hospitals over there, this situation going forward should hopefully not be repeated for us. But again, it's just important to know that it's a demand supply thing. If we keep getting this demand going through the roof for oxygen, we will always keep falling short. So we need to make sure that we curb the pandemic through other routes, bring down this demand for oxygen, make sure that fewer people need it, fewer people need to stay in hospital for that long. So our efforts have to be on the preventive end. We cannot keep looking at the curative end, because how many ventilators will you keep making? How much oxygen will you keep producing? You don't want to keep putting everybody on oxygen and on ventilators. So I would say that the bulk of our efforts have to still focus on the preventive side. But definitely, given that we are in this pandemic, given that oxygen is absolutely life-saving, we need to make sure that now we are fully prepared for this third wave, and between the center and the states, if there are any of these issues, operational, administrative, whatever they might be, they are ironed out. But alongside the center, the states must also keep boosting up their own supply in this regard, because they are completely free to do so. There is nothing saying that only the center can give you a plant and you can set it up. States can also do it on their own, and must do it through their own channels as well, in addition to what the center must do.
All right, ma'am. But a follow-up question of mine would be that, as I said, that the tender for setting up 150 oxygen plants was floated in October. So my question is, why wasn't this tender floated way before October? Couldn't this decision have been taken earlier?
Yeah, I mean, I don't know the specifics of this, and so I think it would be tough to answer this one for me, because I was not specifically involved with this particular empowered group, which is in charge of making this call. So I think somebody else, in the government would be better placed to answer this in terms of the timing, because as far as our empowered group, or what we were doing at NITI Aayog, we have constantly been tracking. Even in the first wave, we were throughout tracking the oxygen requirements of different districts or different states. But a lot of that was based on what we were seeing at that point in time and what we were anticipating. We had actually looked at, because that was the only data we had back in March, April 2020. We had looked at the waves, and the peaks that were happening in Italy, or that were happening in even the US or Spain or other countries, and based on that, we were preparing for the numbers in India. But that is how we were also preparing for our oxygen supplies, etc. But now the numbers that we are seeing are actually far higher than what we would have anticipated in the early part of last year. So I think part of this could be that we did not anticipate, as I said, such high requirements. But I would not know the definite answer to this. I think that would be better answered by somebody who was in charge of the concerned empowered group, because it was the DPIIT secretary who was in charge of that empowered group, which was looking at the supplies, etc. So I think he might have a better answer to that. But I'm just trying to put out what I think might have happened, is that it's not that preparation was not there, but at this level, and at this level of surge, 4 lakh, excess of 4 lakh cases per day, I think that is the level at which perhaps the anticipation was not there. As well as I think the length of stay in hospital has gone up in this wave. And I think that is maybe another important factor. Because in the last wave, yes, people were needing hospitalization, but it was on average for fewer days. So the oxygen requirement was also less. But in this wave, we are now seeing that people are in hospital for longer. People are on average needing oxygen for a longer period of time. So that is another factor which I think might have made a difference to the amount of anticipation that went into this. But I think that is something that I feel from my end, in terms of just looking at the statistics and metrics. But again, as I said, it's we are looking only at the central government side. The state governments, were also completely free to keep increasing their oxygen supply if they thought that they would need it. And I think somewhere, a lot of that also did not happen. So it's really now, I think these are all matters of hindsight, and we can do this sort of post-mortem analysis when we look back, that was the center at fault, were the states at fault, who shares responsibility for what. But I think that this is not the time for that. I think this is the time for us to look ahead, and now make sure that we best handle this situation, as well as what's coming ahead for us in the future. So I think that is, where we should be looking at this point in time.
Certainly, ma'am. That is a very pertinent point you make, that the focus should be in order to increase capacity and to consider the requirements that are to be ensured and materialized for the future, and not look at the past events that have taken place. However, ma'am, there is a lot of confusion within the minds of the average Indians who are tracking the new developments, especially with regards to the oxygen supply, especially the case that happened in Delhi regarding the dispute between the central governments and the state governments as to who exactly is responsible for the entire process of installation of oxygen plants that were commissioned under PM CARES Fund. So my question to you is this, in order to give a sense of clarity to our viewers, and that is, who in whose hands was the complete responsibility of the commission, of not just the commissioning but the complete installation and the operation of oxygen plants and the supply of oxygen plants, and the oxygen empty units, in the hands of who was responsible for this? Was this the ones that were commissioned under the PM CARES Fund? Were these commissioned, or were these installations the responsibility of the center, or were these the responsibility of the state?
Yeah, so I think I have answered that actually already, but I'll just repeat that. That the tendering, etc., was done at the central level, but the actual identification of the hospital sites where they were to be set up, that had to be done by states. Now the reasons for the delay, as I said, are coming from both sides. One is, who was awarded the tender, those agencies saying that the hospitals were not giving us space to set it up, or there were some issues at the level of the hospitals, whereas state government saying that there was a delay, on the part of the agency. So I think that, frankly, right now we don't really know. At least I don't know who is the right one on that or not, and that is something we'll have to look back when we have all the data, and we have all the correspondences and everything that's happened. So I think that is something we need to look back to really know where do we apportion the blame, if we can say, for the delay on that. But the process was clear. Process was clear of the center actually tendering, and then it goes to the states, and then the states identify the hospitals, and that's where it gets set up. So I think that element is very clear. But as I again will repeat, that there was no there was nothing stopping states from having their own plants. Even if PM Care completely failed, even if those agencies just did not come, the states could still set up their own plants. And I think that is very important to understand, that channel was still very much open. That was not closed by any stretch of the imagination. So I think that is how we need to look at it. But in terms of where the lapses happened, we would have to look at it in much more detail, because I think the agencies have a point of view, and then the state governments, the hospitals even have a certain point of view. So yeah.
So, ma'am, very well said, very well explained. But if I were to just simplify it in a three-pronged process, so we can say safely, I would like to confirm this with you once, that the process of the installation of oxygen plants starts with the commissioning of the tender from the center. Then the tender is given to a vendor, an oxygen vendor, or the manufacturing agencies, who then take the land clarification and the land clearance from the state governments for the respective hospitals, and then go and set it up in those places. So this is the procedure of the installation of the plants.
Yes, if they are centrally, tender.
Commissioned.
Yeah, centrally commissioned, but states can commission their own also. I mean, that is also possible.
Okay, all right. So we just wanted to clarify that once, because there is currently a lot of confusion as to on whose shoulders does this burden actually fall, and that's why I felt that we should definitely ask somebody like you, who is an healthcare professional, who is a public policy specialist, who has come on our show, this very pertinent question, which is plaguing a lot of concerns, and it's creating a lot of concerns in the minds of the Indian people. And finally, ma'am, my question to you is this, that testing is regarding testing. for the virus, we have noticed, and there are many personal anecdotes about how there are so many instances in which testing has been refused by centers for many of the people who are going there in order to get themselves tested. So, why is this being done? What can be the possible reason as to why people are being refused from getting tested?
Yeah, I mean, I think a lot of the refusal or people not even being able to book tests is again a question of overburdening of the system. There is too much, even private, it's not just, it's not government, but, even private labs where you're actually paying and you're willing to pay a premium price also, even for home collections, in Delhi, right? If we're sitting here in the national capital, even right now, a lot of testing is difficult. And that is because the system is overburdened. Whether it is testing, whether it is hospitals, whether it's oxygen, everything is overburdened at this point in time. So I think a lot of it's less to do with a refusal per se, but it's maybe just a fact that the system cannot cope to actually process so many tests. Now, of course, we need to expand testing actually in a big way, especially when we look at places like Delhi, where the testing positivity rate is still in excess of 30%. And that means that almost 1 in 3 people, or more than 1 in 3 people you're testing, is actually positive. Now, that is very high. And what that also means is, which makes it very challenging from a clinical management perspective, is that you're only testing the very serious people. Only people who are very heavily symptomatic are actually getting tested, which is not what we want, because we want to test people earlier. If we test people who are serious, then immediately, we probably need to take them to the hospital, and that burdens the hospital system. So we need to test people who are earlier on in their illness, so that should they have any, initial early symptoms, we can actually tackle it effectively in time. So expanding testing is really the need of the hour in many, many places. In some places we are doing well, like in fact, even in Mumbai, we have seen that testing and positivity has improved a lot just in the last few weeks. Now in Delhi, we do need to ramp up our testing. There's different ways of doing it. Of course, one is to just expand the different options we have available for the testing. But the other is, more and more importantly, is the channels for the testing. So whether we have mobile testing vans, for instance, in at least the containment areas, or in areas where there's a number of cases which are being identified, or we have large testing centers where we can just get people to come and get tested through a drive-through mechanism, or whatever that might be. So we need to think creatively on testing. I think there's no doubt on that, because we need to expand it in a very, very big way. And I think we have a lot of these ideas, suggestions which are given, which we also share with the state governments. But also the government is also expanding the laboratories. That work is also on, that at the back end, we also need to keep expanding the laboratories, because there's no use doing a sample collection, if you don't have the laboratory to be able to process it in time. And that is the bottleneck which is coming right now, that you can collect the sample, but the processing, the signing off of the report, etc., we don't have the personnel also. So I think ultimately everything comes down to the burden on the system. I think that is really the very simple thing to say. The testing, the beds, the oxygenation, if we cannot reduce the demand, the system will remain overburdened. The system will be unable to cope. No matter what we do, no matter what any government does, we will not be able to cope. So we have to reduce these numbers.
Yes, very true. And thank you, ma'am, for explaining that so well for the purpose of clarity for our viewers. And with this, I would like to again thank you very much for joining us on our show and explaining to us so beautifully and so wonderfully the entire process and the entire procedure in which the Indian government is so terrifically handling the COVID crisis. And for this, we are really obliged to you for taking out time from your busy schedule and joining us. It's been a real pleasure having you here on our show.
Thank you. Thank you so much. Thank you.
Namaste. We hope you enjoyed this Citti Media content. Please remember to subscribe to us and switch on the notifications for this channel. For our other social media links, more content, and to support our work, please visit citti.net. Dhanyavad. Namaskar.